Hello, guys. Welcome to Room 7 podcast.
Hello guys, hello. How are you, Mr. Yum? How have you been?
Good. How are you, by the way? Sorry, it's been a long time. Not long time. It's been a week that we never do a podcast, but now it's
Yeah,
a
yeah, yeah.
different podcast, right?
Yeah,
Yeah.
yeah. So, it's been a week of no action from us. It's been very
Yes.
busy nowadays.
PCB. Yes,
Yeah,
of course,
but
of course.
okay. So this is gonna be our seventh episode. We're gonna do
Yes.
things. Do things. We try to do things slightly different lah.
Yes.
Apart from our usual podcast, we are also recording
Mm-hmm.
our Zoom cast, and then we'll upload it
Yeah.
to YouTube lah. So you guys can actually see how stupid we look like lah.
Yeah. Yes, at home. So you can watch it in YouTube. You can listen to us in podcast. Yeah. So will be two choices So you want to watch our face or want to listen to our voice.
Okay.
Okay.
So what's the topic for today?
Number 7. Yes, topic for episode number 7. I think we have promo it inside our Instagram. There is COVID vaccine.
Okay.
Hot topic for the past 2 weeks, I think. Yeah.
I think it's not really hot for me.
Hot topic. To me, it's a hot topic because it was. Okay, let me share with you a bit. So when the vaccine flown over to Singapore, so they were preparing for like, okay, who to get it first, who to get it last, whatever, for the so they will decide to put the frontliners to get it first lah. So then
frontliners not only healthcare workers, right?
Yeah, include the those who work in the service side, and even the bus driver also is frontliners. Do you know that? Bus drivers, SMRT personnel and all that. So they are the frontliners also. Even the ICA, who involved in the immigration side, they are the frontliners also. So they're getting it first also.
Oh.
Yeah. Yes.
Okay.
So from there, they were trying to get who want to get it first. You have a choice for the nursing side. This is what I know from structures hospital that either a yes or no, you want to get it now or wait later, something like that. Yeah. So I personally opted as later, not now. Yeah. How about you, Mr. Han?
For me, so you guys have a choice to take now or later.
Yes.
But eventually all must take, is it?
I think eventually, to be honest, okay, when they say yes or no, right, is eventually at the end you will take it also lah. Because I think there's enough vaccine for all of us. Okay. And they were given ample time for us to think, not ample time to think about the reason that we want to take kit, yes or no lah. So I straight away put as no first because I want to observe. That is my answer to this. Yeah. So for you guys, I don't know, because you are not part of Structures Hospital. You're working in the office, so I think you got no choice. But you take it, I think. Yeah.
No lah. See, for me, we have the flexibility to take or not to take lah. But
really?
Yeah. Because for my side, they kind of prioritize those who are doing medevac cases, right? To take the vaccine lah. So since my name is in the list of medevac nurses, right, then they encourage me to take lah.
Alright.
But otherwise, I think my side also same like yours. There are people, who are a bit skeptical on taking it first and decide to, wait a bit to see if there's any reactions or whatever lah. Talking about reactions, right? I did some reading up till now, I think there were only 3 reported adverse reactions lah. 3 people had anaphylaxis from the vaccine.
Just a mild symptom, right? There's nothing like a left and deaf issues or what?
No, I think it appears that these people develop rash, breathlessness, and all those things lah. But to begin with, these 3 people has a history of drug
Drug
allergies.
allergy. So they are safe and discharged. That's what I know. I think.
Safe and discharged from room
Room
7.
7. Bang.
Yeah. And also as of January 28, this is the date that we are recording. January 28.
Yes.
There were 113,000 people who have already received the vaccine. And I think
Thank God.
gonna be more aggressive lah.
Yes. I think because they are start doing the community already. As you guys listen to the news or watch inside in any Singapore news, right? They start in Ang Mo Kio and Tanjong Pagar. It's for the elderly actually. So I saw the news like Lee Hsien Loong was in Ang Mo Kio. Our Prime Minister Lee Hsien Loong was in Ang Mo Kio because there is his GRC there. So he was there to observe and see lah. Yeah. So basically, I think it will start slowly. I think what I think right, they are trying to do is they to aim the healthcare workers, the frontliners, and second is the elderly. Yeah. And third will be the rest of the residents in Singapore. They're trying to do it face by face, which is I think it's better lah. Not like everybody crowded in one hospital lah. No. I mean, this face by face first. Yeah. So until they try to maybe hit everybody by June, maybe before the second half of the year.
Oh,
Which is
okay,
good. Which is good. Yeah.
This is good lah.
It is good.
But but the thing is, right, I think I thought this whole vaccination exercise thing is like a very positive thing. Everybody looking forward to this. Right? But there are people who are quite skeptical about it. I really want to wait for a few years before getting the vaccine. Like they rather get COVID than have the vaccine.
Yeah.
I mean, I spoke to some of these people lah. Like, I mean, I'm not trying to judge lah, but at the end of the day, it's their choice lah. But
like for me, okay. I use me an example because I got COVID. But the thing is that I got COVID, and it's been 6 months plus since the last COVID. I mean, the COVID I had, I was discharged from the Shelley, but I took an options to watch and observe because I don't want to take the vaccine first because I want to see what's the reaction of the public and all that. Yeah. So, anyways, like I think I've been sharing around that this COVID vaccine is a preventer, it's not a cure. So I got my reasons why. So I have COVID honestly, but I was discharged as non-infectious. Yeah, so we are non-infectious. I think the COVID is still with me. I don't know if it dies off. I don't know because this is scientifically the people who are smart enough to know about this. But like I said, I'm a person who took up a no and observe and wait to see what's the next plan for this lah. I will take it. I will tell myself I'll take it. I tell my mom also I will take it, not now but later. Yeah.
So you are people who never take
Yes, bro. I'm immune, bro. I'm immune. I'm got the immunity, my friend.
Yeah. Actually, okay lah.
That's like half of the answer. Yeah, we have our reasons. Those who got no COVID but still not taking it, I don't know what's the reason. We should ask them actually, but I don't know what's the reason for not taking it. We want to observe. Maybe I think that they listen, maybe they watch or they listen to news in the US that people taking COVID vaccine they die after that. Yeah, pengsan lah. They develop allergic reaction, a very bad allergic reaction. Then they hospitalized and they were in coma, whatever, not blah blah blah. Yeah, so I think this kind of news will spread around the world. So as Singaporean as we are, we like, you must be careful lah. Do not take it first We must watch and observe all this kind of the Singaporean mindset. I mean, it's okay, but it's okay that we just.
I thought Singaporean kiasu, bro.
Yeah, they are kiasu one, but they like, okay, must be careful lah. Everything must like, we see first. Yeah.
Okay. Yeah, because that was one of the response that I heard lah. Like they felt that this whole COVID vaccine thing happened a bit too fast as compared to other vaccines. Which took a couple of years for the vaccines to develop. Then I think the main concern is safety lah. So that's why these people rather wait to see if there's any reaction or any side effects of this vaccine.
But talk about vaccine of why are you taking it? Some people thought, okay, this is why I am going to say that. Some people thought, oh, we got a vaccine, take twice already, means you are free to fly all over the place. Actually, no, this is not the story actually. We got a vaccine to prevent you to get that COVID lah. But I don't know what's the chances of you getting the COVID if you got two vaccine. When you are okay to get the vaccine and all that. What are chances to get the COVID? We don't know, really, to be honest. I think those smart people from who created this medicine, maybe they predicted that this is going to be a better one, whatever lah. Yeah. So like for us, I think they assure us that this is a preventer, to prevent you to get COVID lah.
Oh, but then did they mention about like total, like you totally cannot get
This one I'm not so sure. I'm trying to find out more. I have the slides at work where they were rolling out doing a roll call, but it's too long and it's too dry. Honestly speaking, it's very scientific. Very Big Bang Theory stuff. Honestly speaking, I'm a nurse even though, but it's very Big Bang Theory stuff like physics, chemistry stuff.
Okay, rocket science lah.
Yeah, rocket science, bro. Big Bang. So maybe if I have the slide, I read through first before I post out in our Instagram page what does it contain and all that. But for now, it's a bit too dry for me to read it up because it's too long. Yeah.
But then again, I think the concept is probably like any other vaccine. I mean, we go for our
flu jab,
right?
Yeah.
Like for me personally, I feel that it does work. For all those years when I kept taking flu jab, right? I think I hardly ever
had flu.
Had flu, really. Then once when I stopped taking, right? Because after leaving hospital, you don't usually get vaccinated, right? Then I think I fell sick like a couple of times in that year, having flu, rhinos, all those symptoms.
So that drug is like the body needs that. I think once you inject, the body needs that drug to
dependent.
Maybe I don't know. Yeah, to get you not get that flu, for example. Yeah.
But also when you have a flu jab, doesn't mean you won't ever get flu lah. I mean, I guess the probability.
You never know that you can get anytime. Actually, you just cannot guarantee. That's the word, cannot guarantee. Yeah. Hey, by the way, guys, we're not trying to like give you false statements or what. This is what our opinion is. Like Mr. Han here and me trying to share our opinions, our experience. Yeah, we're not against it. We're not like it, but we're just love to share money. This is our thing, sharing.
Guys. Yeah, we are just full of opinions, but we are not Big Bang Theory.
Yeah, we are not Big Bang. Bazinga. So how many thousands? So how many thousands of Singaporeans get it? It's about
113,000.
Alright.
Yeah, and they plan to at least vaccinate 2,000 people every day. Yeah, and then let me see here what else. So for those of you who don't like to read the news, so here I am reading for you. Okay, so far 113,000 has been vaccinated as of January 28th day. Okay, and so Monday onwards, right, all 20 polyclinics, right, will be offering COVID-19 vaccinations.
By next week. That means today is
Monday.
28. The recording is now 28. Monday will be 30th, is it?
Monday
31st, right?
30th.
About that lah. So wow. So polyclinics offering, is it must be payment or is it free for the public? Must be Singaporean lah actually. Is it?
I think it's free bro. You don't have to pay. Because I also never pay.
Oh, okay.
Yeah.
So it's free for the public to go to polyclinics lah. Yeah, by the way, right, do not hop to the polyclinics because I know, okay, Monday is the day that they will put it out in all polyclinics, but I think as kiasu as you all are, we cannot like queue up for hours. Okay, just relax. There's enough COVID vaccines there. Yeah, you can. We got how many polyclinics in Singapore? 20 plus, right? 20 plus polyclinics in Singapore.
20.
So like, I mean, if Monday you cannot go, it's okay. Tuesday you got until Saturday to take.
Okay, but anyway. But anyway, okay, since I've already received the vaccine, right? Let me just tell you how it works.
Yes, you share, better share.
I share sharing session.
It's your master flex.
So basically, before I actually got vaccinated, I sent in a request to my workplace lah. So my workplace will be on behalf of all the employees who want to get vaccinated, right? They will send in a request to MOH. Okay. So it took a couple of days. Then after that, once approved, MOH directly SMS me lah. Okay. Then after that, message. MOH directly SMS me, saying that you have been approved, something like that. Then please click on a link on the SMS to make your appointment. So I make the appointment lah. Then I make.
How long need to wait? How long need to wait for make the appointment? 2 weeks? A week?
I think 1 week. 1 week. I think I know. For me, I was lucky. Because my area 1 week have there was already an appointment because you need to book for 2 appointments.
Yeah, the first jab, second jab.
Second dose. So some of my colleagues, right, they managed to book the first one, but the second one they are not able to book because it was packed or what for the 2 weeks. Yeah.
Oh yeah, maybe it's because of Chinese New Year. Maybe.
Not sure lah. So I had it early January. And then so I booked already. Then I went. Normal. Just go there. Then they ask you to verify your. They want to see your SMS. And then.
Okay. Alright.
Then after that I got the jab. Okay, they will explain to you. Okay, you know what you.
How long you need to wait for the jab? Okay, I mean when you are there, you scan your IC, then you need to
very fast.
Very fast.
For me, very fast. Because so you go in. Okay, you go there. You wait for your number. They call you in first for triage. Okay, they will triage you, see if you're well, you're sick or not. Okay.
Your blood pressure and all that lah.
No blood pressure. Just
asking.
Just questionnaire.
Alright.
Then after that, they charge you. Okay, sir, can you please sit outside again? They will call you again for the jab. Then second time I go inside, then they explain. Okay, then after I got the jab. But after the jab, right, you cannot go home yet. They will put you at a holding area for 30 minutes. After 30 minutes up, then you can shower.
Right. They want to observe you got any develop any symptoms for the next 30 minutes. Right.
Yeah, but for me, no, like for me, like just like any other jab, like jab already, just a bit sore on your arm.
Yeah, of course lah.
Then like 2-3 days okay already.
Okay.
So far, 1 week plus already, I still feel good.
I feel good. So they put chemical X in your body and become powerpuff girls lah.
The rowdy rough boys
Okay. So that's Mr. Han's experience about getting a jab in our local polyclinics. So it's the the what call it, the point that he booked the appointment, or the point that he received an MOH or SMS, to the point that he went there to scan his IC, triage, get the jab, observe. It's about 1 hour maybe, or 1.5 hours maybe.
I think
could be like that.
1 hour tops lah.
1 hour tops lah. Yeah. So don't worry about like, oh, some people talk about polyclinics, right? They will be like, a lot of people go to see doctor. Actually, you're not seeing doctor, you are seeing a nurse to get a jab. There's a difference. Yeah. So you are seeing doctor, of course the consultation is very keep around, but this is just a jab only, a procedure only, just a procedure.
Yeah, correct. So I think they really segregate those who are getting the jab, right, into like one corner, so they won't disrupt the whole polyclinic operations.
Is it like batch by batch, like you are in this batch with all the people that you're with? Is it like that?
Yeah. So all the people that are getting COVID vaccine are segregated from the rest.
I see.
I don't know. Personally, I feel, and I think it's quite efficient. Coming from polyclinic, you know.
Yeah. When you talk about polyclinics, there's always a bad review. But to me, when I fall sick, I always go to polyclinic because I trust them. For me lah. But I heard from others, this is what others say, like, too many people lah, ramai orang lah, waiting time very slow lah, must book appointment through the handphone lah, the health hub lah. There's a lot of reason they will say. But for me, I don't like to book appointment through the health hub because it's so leceh, so mafan. So what I did, I just walk in lah. Yeah.
Oh, is it? Yeah, but you walk in way longer, what?
Of course I wait long lah, about 1 hour. But dude, you sit there, there's Wi-Fi there. There's a stall there, you can buy water or what. Sit there lah. It's aircon.
Listen to podcast lah.
Listen to our podcast at Room 7 Podcast.
Sempat.
Yeah. So it which is cool lah, by the way. So it's nice. I mean, nowadays polyclinics are better than the last time we talked about polyclinics. They're aircon and all that. So don't worry about, I don't want to wait so long. Dude, the seat is okay to sit down as long as you are there to sit. There's a water, free flow water to tap in and tap out the thing. So yeah, there's Wi-Fi also. So what are you worried about? Yeah, the waiting hours is very long lah. Yeah. But for the jab, I'm talking about today's topic for the jab is very fast. That's what Mr. Han say.
Yeah.
So next question is, so you are a yes person in this lah. In this.
Yeah, I'm a yes person lah. When they ask me, I don't know.
You don't like
I don't really
think
hesitate
twice, or you want to discuss with your family first, or what?
No, I just go because I'm a man of science. I believe in science. And then I believe in science. Then you ever heard of Murphy's law? No?
Yep.
Whatever can go wrong will go wrong. So if go wrong. Yeah.
Like for me, I'm a no first, but I will say yes later. So observe and wait.
Well, I think in our upcoming episodes, we need to start inviting people because
I think we should. We okay. By the way, guys, we are planning. What were you going to say? We are inviting guests. We are planning to bring people in, but we need to know their schedule also. We cannot anyhow like take someone from somewhere, then just put him here, then talk about something. No, we need to have a plan. Correct tak? Betul?
Correct.
Right.
Yeah, because you know. Okay, so guys. So if you're listening, right, you guys have been listening to us.
Yeah.
Okay, for including this episode,
7
times. No, we've been hearing us talking nonsense. I'm sure you guys will want to hear perspective from a third person, a third neutral person, right?
Yes.
Yeah. So and it can be anything lah. I mean, we already talked about career progression. We already talked about sensitive topics, and all these things that we talk about is between me and Mr. Sayum here. Sayum here.
Y to the U to the M.
Yeah, but so I think that it'd be great if we can have a third person. And then that, and if you guys want to be a part of this podcast, right?
Want to share your stuff?
Yeah.
Please do DM us. Okay, that's the reason why we keep saying
Okay.
DM us.
Hey guys, if you are listening, right, if you join our podcast as our third person, I will give you $1 in person. I'll go to your place and give you $1 as a token of thank you, and one sticker.
Wait. I think we up the game. $1, one sticker, and one free drinks.
Oh, okay.
On us, because we are being our guest, right? So we give you at least.
Correct.
Yeah. A guest, as a host, we need to bring our guests in. We offer them something.
Okay. Can I? See you.
Starbucks drink or what? Yeah, I'm okay, man.
Okay. Okay, guys, remember, be part of the show and get yourself $1, one sticker, and one free drink. Okay? And then they also being part of this podcast doesn't mean you have to meet up with us and all of us to record together. No, we can do this like how we're doing right now via Zoom.
If you are not comfortable with two men interviewing you can do it at Zoom basically. But honestly speaking, we are okay to meet up outside and outdoor in a park or what in the daytime, by the way, and we have to discuss but we will discuss it in a manner of social distancing and wearing a stupid mask or what. Yeah, a very creative one. So we're trying to do something creative if you're doing outdoor. Yeah.
Okay, guys. So keep your eyes peeled. Do consider being part of the show because nurses who stick together work better.
Where do you get these quotes from?
A quote from a famous person, Mr. Han. Okay. Anyway, back to the topic.
Yeah, I think we conclude just now.
Oh, is it?
So I think for me it's good to take. I think you also said for you good to take lah. But like I said, if you want to take, it's your choice. We don't want to push you. Correct or not? Like Malay, if you was it's haram already. Don't was.
Yeah.
The Mufti also said really that it's okay to take the vaccine.
Oh.
It's for the safety of your family.
Oh yeah.
Don't be selfish. Yeah.
Correct. If you guys were to look at the FAQ for this COVID-19 vaccine, right? They do address questions like whether this COVID vaccine is halal or not So if you guys are really into that, you can go to the website, MOH website, and take a look.
Yes.
Okay. Oh, I think I want to say getting vaccinated is really entirely your choice. But I was watching CNA earlier today. Then I saw because this vaccination exercise is going on globally, every part of the world is trying to get their people vaccinated. Then it seems that even Singapore currently, for what I know, it is free lah. I didn't have to pay anything. Okay, even if I have to pay anything, it will probably be coming up from my MediSave or what lah. Okay, but I didn't fork out any cash. Okay, but there are people in South Africa, right? They want to get vaccinated, but they don't have the money because they are required to pay for the vaccine. So count ourselves lucky lah.
Like some countries like a third world country that they need money to pay a lump sum for that. So we are lucky to have free vaccine, but take this opportunity. It's free, just take lah.
Yeah, and then okay lah, getting vaccinated is one thing, and then I think we still shouldn't be complacent lah. Like other countries, like Malaysia is in lockdown again.
Yeah, the PPP and what call it MCP? What's that? I can't remember what in English. MCO. Yes. Yeah, another 2 more weeks. I don't know what happens to that side, but For room 7 nurse, we are supporting them wherever it is. So just tahan for a while, guys. Just tahan for a while. Yeah.
And then you look at UK lah. UK also is getting really bad lah.
Europe part I think is bad lah. Europe is quite bad though. That's what I got to know about this COVID thing. Europe is quite bad. So they are trying to controlling it, but somehow or other they are like, I'm not gonna say this, but this is like they want to open up the borders, but the problem is that they need to control the numbers of COVID. It's like they don't know where to start, where to stop, and all that. Yeah, so a big country like that you cannot control is very difficult. Really. Very difficult to control the
but but on the other hand, New Zealand is like totally closing its borders. Until the whole thing resolved, then they will consider opening up their borders. I mean, at least they made a stand.
Stand that no visitors allowed.
No means no.
No, nobody can enter room 7. No lah.
Yeah. Okay, so
I think
do you miss out anything?
We don't miss out anything. We just sharing our side about COVID vaccine. So I think we hit all our main points already. Yeah. So I think this is what we're sharing. By the way, the info what Trihan shares from the news is from CNA. So so we can read up in CNA about the latest news about COVID vaccine.
Yeah. So at the moment we can only give our opinion and what we read on the news lah. If you are actually looking forward to some scientific stuff, right, like Big Bang Theory stuff, I think for now no lah. If you do like that kind of the Big Bang Theory data, right, just let us know. Then maybe I can do some research for you lah.
Yeah. So I will do some slides for you guys.
Not that I like doing it, but you know.
Sharing is caring.
For the viewers.
Sharing is caring.
Okay, so I'm gonna say again, we are recording this session. And I'm gonna upload it on YouTube.
We have our YouTube channel coming up. Not coming. I think once this recording is over, we will open up a YouTube channel at Room 7 Nurse. You also can listen to us in podcast.
No, actually, when you are watching this, it's already on YouTube.
Yes. So if you like to see our ugly face, you can listen to us in audio. That is on Spotify. Okay, Spotify you need to pay for the premium, but Google Podcast is FOC. True or not? True?
Yes.
Yeah. But we are not in Apple Podcast, by the way. About what iTunes Podcast is it? I can't remember.
No, bro.
Someone request for iTunes Podcast, but we are not there because I think there is much. We need to pay. I think for that to upload. I can't remember. Yeah.
And then so do keep listening to us, and then please let us know what you guys want us to talk about.
Yeah.
Like you all like very quiet only. You're like very quiet. Just tell us what you want to hear. I mean, we'll be more than happy to.
Just comment lah. What you want to say. Can you talk about this? I know some of you want to talk about mental health. We will touch on that. But we need to do more research about it before we say, because mental health is a global, worldwide thing right now.
Okay, but if you are a mental health nurse, please.
Yes.
Alright. And still remember, and then talk about mental health. Okay, no. And talk about inviting people, right? Still up to now, no nurse clinician, reach out to us to,
I need a NC. I don't care how many years you work as an NC to step forward and willing to talk to us, but we will like put you as anonymous lah if you don't want to reveal your identity. It's okay because we're not asking you a very tough question, just like a normal questions like what is that to be an NC and all that.
It's not gonna be a tekan session. It's gonna be a sharing session.
As a nurse, I also as a EN, like I want to know like what is your job scope actually. Like
is there something that you know that the ground staff don't know? Okay, now we are deviating in this topic is about vaccine, but emotionally
I think they're scared But no, of course, we're not very controversial podcasters. We're just relax, chill. Yeah.
Chill lah. Yeah. I mean, at the end of the day, Mr. Yu, if we lose our license because of this podcast, we'll just be full-time podcasters lah.
No, I will do food podcast and I will sell food at hawker center. I want to be a hawker. Sell ayam penyet. Okay, can boleh tak?
Okay, can. Okay, so Mr. Yu, anything else for vaccination?
Let me type out your discharge summary and I think we can. You want to see the word?
Okay, after you.
Discharge, oh.
Room 7.
So discharge.
Discharge.
7. Discharge. Bye bye.
This is number 7, by the way. Bye guys.
Not gangster sign.
Exercise, I don't know.